Morning, good afternoon, or good evening, everyone, depending where you're joining us from today. Welcome to the Universe 21 Health Science Group Interprofessional Education webinar for 2024. My name is Dr. Sharon Miller, and I'm an academic at the University of Melbourne here in Australia. And I'd like to acknowledge that I'm joining this meeting from the land of the Wurundjeri people of the Kulin Nations, and I'd like to pay my respects to elders past and present, and certainly recognise First Nations people from the lands that you are joining us from this evening or this morning or this afternoon. It's my very good fortune to be able to chair this session and to introduce our speaker. But before I do that, I might just do a small matter of a bit of house. You won't be able to come off mute and you won't be able to use the chat function, but you will be able to ask questions and answers. So please, or ask questions through the Q&A function in the toolbar. So please, if you've got questions as we're going through the session, please pop them into there and we'll make sure we've got time at the end where we can talk through those. The session is being recorded and our speaker has kindly agreed to allow for the slides to be shared. So they will be circulated by the group by email and you'll be able to access them after the session. I think without further ado though, what I'd like to do is introduce our speaker tonight, Professor Sharon Pfleger. Sharon is a consultant in pharmaceutical public health at the NHS in Scotland. As a registered pharmacist and public health specialist, she focuses on the environmental impact of healthcare, particularly medicine usage and climate change. Sharon is a founding member and NHS lead of the One Health Breakthrough Partnership, addressing sustainable medicine use, antimicrobial resistant and microplastic pollution. Sharon actively participates in Scottish Government committees, while also serving as a visiting professor at the Royal Robert Gordon University, leading research on environmentally conscious formulary decisions. Our webinar tonight is this morning, afternoon, I can't get out of my time zone, is numbers, data and statistics and how they can tell a compelling story for population and climate health. Sharon, thank you so much for your time. Handing that over to you.
And thank you so much for that kind introduction, Sharon. I will just share my screen now and hopefully get my presentation up. Now, can you see that okay? Yeah, great.
Indeed.
Thank you so much. Well, as Sharon said, yeah, good morning, good evening, good night, maybe to some of you. I'm calling in today from Scotland, so it's still morning with me. And I'm delighted to be here today. So thank you so much for the invite to talk to you about numbers, data and statistics and how they can start to tell a compelling story for population and climate health. Now, let's see if we can get these slides to move. There we go. So today, I thought I'd discuss some of the challenges around climate data, how we understand it and how we can actually use it to share the climate change message, both if we're teachers, if we're academics, but also if we're health professionals, but also just as people living on this planet and sharing the message about climate change to all our friends and colleagues. And then finally, I wanted to give you some top tips about how you as a healthcare professional can actually live and practice more with a climate lens to get the message out. But first of all, I just wanted to recognise eco-anxiety. Eco-anxiety is a recently new mental health condition that's been recognised. And you can see some quotes on the screen here from research that's been done in Scotland with over 45% of young people saying that climate change negatively affects their daily lives with their feelings, and that 8 in 10 young people are worried that climate change is threatening people and the planet. And it's not just young people, I think, for many of us, when we see data sometimes in the way it's presented, it does make us anxious. It does make us think, well, gosh, what can I do to help this? It all seems too big a thing for us as individuals to do. But hopefully today you'll see that actually it's not, and we can all make a difference. Now, we've probably all heard about climate change and organizations and businesses heading towards net zero, but I wanted to make sure that you understand that we're actually in a triple planetary crisis. And that is made up of three things, like it says on the tin. Climate change, so that net zero carbon emissions going into our atmosphere and global warming. It's also a loss of nature and biodiversity. And the third big one is pollution. So pollution by many of the daily chemicals that we now use in our lives, and pharmaceuticals or medicines are one of those, and I'll come to that later. And yeah, it's sad to say, but actually, if we as humans didn't inhabit this planet, there wouldn't be any climate change. There wouldn't be that triple planetary crisis, because it's our choices, it's our consumerism, it's our need, our want to buy more stuff all the time that is driving carbon emissions and pollution across the world. So the first thing that we can do as citizens of the world is actually make better choices. So think about the choices that we do make. Use our legs more. Walk or cycle is a really easy one if we've got short car journeys or short train journeys. Think about the energy that we're using on our lives. Just switch off those lights if you don't need them. So really, really simple things that can start to make a difference to our energy use and our technology use and our general consumerism. Now, I wanted to start off looking at quite a simple way that we can use data to talk about climate change, and that is thinking about Earth Overshoot Day. So every time we use something, every time we buy something, we're actually demanding ecological resources from the planet, from Earth. And so Earth Overshoot Day actually marks the day when our need for ecological resources and services actually exceeds what the Earth can regenerate again in that year. Or if we put it really simply, it's when we actually bust Earth's budget and we are living in overshoot. Now, if we got our month's salary and we spent it all by the middle of the month, we would be living in an overdraft situation. So that's essentially what we're doing in the Earth when we're using too many ecological resources. And you can see there that Earth Overshoot Day is actually getting earlier and earlier every year. So that is a real worry for us. And another way of looking at it is how many Earths would we need to live if we lived like, for instance, the United States of America. So currently the United States is using about 5.1 Earths every year. Australia's sitting at about 4.5, Japan 2.9, Spain 2.8. So it's really interesting. It really kind of focuses us on what we and the other citizens in our country are living like and what that's causing the Earth to do. And then another way of looking at it is representing the data graphically like this. So we have the Earth, we have the months going round it, and remember that I said Earth Overshoot Day this year for the world is going to be kind of middle of July. But every country is different depending on their energy use, depending on the homes, the way they build their homes, depending on travel infrastructure, etc. Is it mainly car use, or is there a really good train infrastructure, a really good public transport infrastructure for people? Is it a meat-based diet or is it a plant-based diet in the country? So you can see here that by February the 11th, if you live in Qatar, you've already bust Earth's budget within 6 weeks of the new year, which is really quite staggering. It's a really hot country. They probably use lots of air conditioning. They drive still probably fossil fuel vehicles. So that explains some of their consumption. And then you can probably spot your country as you go round the wheel of the Earth there. And if you go to somewhere like Jamaica or Iraq, right up on the left-hand corner, you can see that their Earth Overshoot Day doesn't happen until November. So they're using resources in a much more conscious way than some of the countries on the right-hand side of the diagram. So just in those three different ways, by stating one day of the year, by looking at how many Earths we use as a country, and by looking where on the calendar our own country's overshoot day comes, you can see there's lots of different ways of using data to display, to tell people about an issue or a problem about climate change. I'm having a bit of a sticky mouse here. There we go. So I was really astounded when I calculated my own carbon footprint, because when I travel to work, I travel by train. It's about 100 miles to my office. I don't travel very often, but actually, yeah, things add up that we do in our life. So I'd really commend to you to try calculating your own carbon footprint. This is just one footprint calculator that's available from the Global Footprint Network. There are lots of other ones, and there are some country-specific ones, depending, as I said, on what type of housing you have, what infrastructure, etc. And these are just a few screen grabs from this calculation. It's about thinking about your diet. How often do you eat animal-based products? Thinking about your house. Is it freestanding? What's it made of, etc. How you travel, what fuel you use to heat your house or cool your house. So it's really quite interesting. So have a go yourself, and then start making those small changes in your life. So if you eat an animal-based, a meat-based diet, one day a week, try not to eat meat, because every little does count. Now, this is another really interesting way to think about data in our world. This is Kate Raworth's donut, economic donut. Now, let me try and explain this one to you. So the dark green circles, you can see the ecological ceiling there and the social foundation, and that encompasses a light green bit within it. And that light green bit is when our ecology and our social foundation are all quite happy. So when they're quite happy, it's a really safe and just space for us to live in. So if I could give you the example of, say, for instance, the pandemic, right? During the pandemic, it had ecological changes, but most of us probably saw the social changes more closely. So a lot of our work stopped. Many of us had furlough. We were put into furlough. We weren't getting our usual salary. We weren't at work with our colleagues. Our housing, we had to stay home. We weren't allowed out. Our food, there were food shortages. There was pasta shortages. There was toilet roll rationing in various countries. So all of those things made us feel less safe. There were even queues and fights building up in supermarkets across the world, people trying to get that last packet of pasta or that last bunch of bananas. So all of a sudden it shows you when our social foundation starts to falter, so does our general justice and our safety in humanity. So if we think about the ecological ceiling, and if we start to see climate change, we start to see more air pollution, loss of biodiversity, chemical pollution, ocean acidification, all of those things actually overshoot our ecological ceiling, and we then start to be more unsafe as human beings. We start to have wildfires, we start to have more storms, and they themselves can cause ill health and death for humanity. So that's another way of looking at the data. So this diagram shows us when it's quite safe, when things are all at one with each other. But this diagram, developed by the Stockholm Resilience Centre, actually uses those planetary boundaries. And this is their most recent paper, published in Science Advances. And it shows that we've actually started to overshoot 6 of the 9 planetary boundaries. Now, if you remember the Raworth model on the previous slide, we have to be within a safe and just space. But the minute we start overshooting those planetary boundaries, things start to go wrong. So you can see that the purple represents when we're really moving into an overshoot. So when it's green, it's fine. When it's yellow, we're starting to overshoot. When it's red, yeah, it's getting pretty dangerous. But purple is actually, yeah, we're really doing dangerous stuff to those planetary boundaries. And you can see here that novel entities, which includes pollution, which includes pharmaceuticals, is actually edging into the purple zone there. Ocean acidification is still in the green, but we know that in years to come, we are on a trajectory for ocean acidification to be overshot as well. So lots of lots of ecological things happening in our world that will have ramifications for us as human beings. And I think this display of the data is actually quite useful. It shows us where our priorities should be, what we should start to work on and really think about as healthcare professionals. So this is another way of displaying data about climate change. The IPCC is the Intergovernmental Panel on Climate Change. Let me find my false teeth again. And you can see it does reports. There are hundreds of scientists worldwide involved in IPCC reports. And this is the sixth report, the findings of that sixth report. And you can see here it's saying that continued greenhouse gas emissions will lead to increasing global warming, and with the best estimate of reaching 1.5 in the near term in considered scenarios and model pathways. And every increment of global warming will intensify multiple and concurrent hazards. Deep, rapid and sustained reductions in greenhouse gas emissions would lead to discernible slowdown in global warming within about 2 decades. Well, I don't know about you, but that doesn't really make sense. And I'm a scientist. I'm a scientist that works around climate, that works around pollution. But to me, that's not really telling me what I need to know. It's scary, actually. It's quite scary. And I can see that people on the street probably wouldn't have an idea what IPCC is talking about. So as healthcare professionals, that can make a difference in the climate change, in the planetary crisis that we're in, we have to find a way of getting those data into a more palatable, a more relatable way for the average person on the street. In the UK, the average reading age of our public is 9 years old. So I'd urge you to find out what it is in your country as well. It probably might not be that different. So if the average person on the street has a reading age of a child that is at primary school, we really do need to find better ways to get our message over about climate change so that everybody can start taking action. And quite often we see these temperature graphs as well. So this one's telling us what the UK temperature, the annual mean temperature is. Okay, so first of all, annual. Not many people with a reading age of 9 understand the word annual. If we're talking statistics, the man on the street doesn't understand what mean, mode, median means either. And if I look at that, it's like, well, yeah, it's about 1.5 degrees we've gone up in 136 years. And well, that doesn't seem very bad to me, actually. And if we look at all those lines on the graph and we look at the color coding at the bottom, that's all quite difficult as well. And actually the graph starts at 7, it doesn't start from 0. So what's this graph telling us? Yeah, again, it's pretty difficult to interpret that. So what it's telling us, we don't really know. What do we have to do as a result of the graph? It's not telling us. So climate data are confusing. And this is a pictorial way of representing the data. This is showing Europe getting hotter and hotter and hotter. And this is probably an easier way to show us why global temperatures really matter. And sometimes if we put it into numbers that people are more familiar with, it's easier. So if we have 1.5 degrees Celsius warming, it means that over the next 5 years, probably 14% of our population will be exposed to a severe heat wave. But if we go to 2 degrees of warming, that's just half a degree more, this jumps to just under 40%. So that's more understandable, but still many people don't understand what percentages are either. They don't know that 14% means 14 people out of 100. So we really do have to think about the audience that we're trying to get our message across to. And as healthcare professionals, if it's to patients, then we really need to think hard about that. And that 2 degrees of warming you can see there is also meaning that 61 million more people would be exposed to severe droughts. But even though NASA has produced these data for us, they're not telling us why that matters. So a severe drought, if you have a severe drought in your country, you might not be able to get water to drink, to bathe with, to cook with. Your animals may not be able to graze, so you may not have meat products, your crops may fail, so we fall into food insecurity. So there could also be famine. So all of these things, whilst we see this lovely picture showing us the darker the red, the darker the temperature and the heat wave, it still doesn't tell us the whole picture. This is an infographic from the World Wildlife Fund, and it's getting there. So many more people. We've got to remember people's learning styles. Some people like to listen, some like to look at data and graphs, some like pictures. And this kind of combines a few of those. So again, it's percentages, it's numbers, but it also includes pictures to make people link the numbers that they see with the pictures. If I just pick out extreme weather at the top there of the infographic, you can see that 1.5% is coloured in the light orange and the 2% is coloured in the light red. And if we move from 1.5 to 2, we would get a 170% increase in flood risk versus 100% increase in flood risk. So that's a little bit easier for people to see, but it's still not the full picture. But what all of these data are showing us is that actually the science is pretty clear out there, and every half a degree matters for the world. So if we can keep global warming within the limits of the Paris Agreement, we have a hope at turning climate change and that triple planetary crisis around. Now, as I said, different people have different learning styles. Since the pandemic started, actually, for the last 3 years, I've been in a global leadership program for women and non-binary people in STEM, so working in science, technology, engineering, maths, and medicine. Learning about leadership, about visibility, about strategic thinking, and about the science behind climate change. And the culmination of that learning journey for me was a 3-week expedition to Antarctica. Now, there is a part of me and a part of all of us that went on that journey. There were 100 scientists that went. There's a part of us that actually said, wow, should we actually be going to Antarctica? Because that is a lot of carbon emissions. And yes, we were working to offset those. But so that played in our minds. But actually, what we were told was that if we see something up close, it will stay with us forever, and we will come back as better leaders, and we will be able to lead for climate change. So I'd like to share with you today, because part of my journey was coming back and sharing this message with people. So I've shown you lots of different types of data and how we could use those data to get our message across. But maybe if I tell you my own personal story, you can share that too. So I'm the one standing in the blue coat there next to the ship, and the tall one on the right-hand side, holding the flag up and walking onto the ship. So what I never knew before I went to Antarctica is that it is big. It is really huge. And you can see here that Europe, Scandinavia fits nicely inside Antarctica with lots of space to spare. If we showed America, we could fit South America and Mexico, etc., inside it as well. So it's important. I want you to remember Antarctica is huge, because some of the stuff that I'm about to tell you, always think back and think, yep, it's big. There's a lot of ice down there. Now, I took lots of photographs when I was away, and this is one of the most boring ones I think I could have shown you. But it's really inspiring and it's exciting as well. And the reason for that is that this is the first iceberg that we saw when we left the Falkland Islands. So we went from Argentina to the Falkland Islands and then down through the Weddell Sea to Antarctica. This is the first iceberg that I saw that was evidence that we were getting close to Antarctica. So why is that exciting? Well, it's maybe not, it's exciting in one hand, but it's also scary in the other. The night before, when we set sail from the Falklands, we were asked to put our estimation of the time that we would see our first iceberg on a note and put it into a tin. And then we would see who was the closest to spotting the first iceberg. Well, the expedition leader called us over the tannoy and said, here's your first iceberg. But it was really quite scary for her too, because this was the furthest iceberg that they had ever seen from Antarctica through the Weddell Sea, making its way back up to South Georgia. Why was it the earliest one? Because it had obviously calved much earlier, and the sea action had taken it much further up. So it's a representation that climate change is happening in Antarctica, that the ice sheets are melting, that the glaciers are calving, and icebergs are able to be in the sea for much longer. So that's why that's scary. And that has stuck with me, even though it's a really grey picture on quite a boring day with quite a flat sea. That shows me that climate change, even at the bottom, one of the coldest places in the earth, is happening. So yeah, and these were some of the ice fields that we had to navigate through. And sometimes our ship had to turn around because there was so much ice that it couldn't navigate a passage through it. So yeah, Antarctica is melting, the ice is melting. It was losing an average of 40 billion tonnes a year since the 1980s, but since 2020, that has increased 6 times, and it's now losing about 250 billion tonnes of ice a year into the sea. Now, that will change our sea level. If Antarctica itself melts, it will change our sea level by 60 metres. And again, that doesn't mean much to people. What is 60 metres like? What does 200 feet look like? This is what 60 metres looks like. So probably most of us around the call today will have our houses, our towns, our villages flooded if the sea level rises by 60 metres, unless we're living at the top of mountains. So that's quite scary in itself. So this is just another way to demonstrate to people when we're talking about sea level rise. We're saying, yeah, it's going up by 4 inches. Yes, the Maldives are going to be covered quite soon. And people are thinking, well, that doesn't really affect me in the Maldives, does it? But actually, it affects us all in the world. And if Antarctica keeps melting at the rate that it is, and the Antarctic continent melts itself, we will see that 60-metre sea level rise across the world. So the Southern Ocean around Antarctica is the most vital ocean in our world. It has absorbed about 75% of the excess heat that we as humans in the world have created, and it also has absorbed about 40% of our carbon dioxide. Now, the more CO2 the ocean absorbs, the more acidic it becomes. So we're heading towards ocean acidification. And when we head towards ocean acidification, we kill the animals that are in there. And once we get to a stage where all the carbonate in the sea has dissolved, dangerous, poisonous phytoplankton take over, and they poison the ocean so that nothing can live in it. So we get no fish, we get no more sustainable fish for our diets. So that affects humans. But the scary thing about ocean acidification is that about 3 years after the ocean acidifies, Earth can no longer support human life. So it's really key that we try not to emit carbon dioxide so that we don't acidify our oceans, so that we don't kill off life on Earth. Now, another important thing down in Antarctica that I saw was as the oceans get more acidic, the krill die. So the oceans are absolutely teeming with krill in Antarctica, but they're dying at a rate that they haven't done before. And this is really important for the animals that live down there. So I saw 5 types of penguins when I was in Antarctica, and they mainly eat krill. So if the krill are dying, the penguins are losing their main diet. So for the gentoo penguins, the krill makes up the majority of their diet. So they would be the first to go if krill die off. The chinstrap penguins, they also eat krill, but they also eat shrimp and fish. But of course, the shrimp and the fish also eat the krill. So if the krill die, we don't have any of those animals in the food chain. So chinstrap penguins are already quite seriously threatened by climate change. This is a humpback whale. This was taken by Professor Mark Brandon from the Open University in the UK. Mark is a climate scientist around our our Arctic and Antarctic poles. He's an amazing guy. We were lucky to have him as one of our expedition leads, and he's taught us such a lot. But this beautiful photograph that Mark took of a humpback whale just shows that these are at risk as well. They eat krill. Humpback whales have baleen, so they filter krill when they take big gulps of water. So they will be at risk of climate change too. So sometimes speaking to people about climate, it's very useful to use animals because they bring out our emotions, and we can, the whale is the most favorite animal of mine, and I was just dying to see whales when I went to Antarctica, and I was lucky to do so. So if we link into something that matters to people, into people's emotions, we can sometimes get the climate change message over much more easily than showing them graphs that they don't understand. And while I was in Antarctica, an iceberg called A23A broke off from Antarctica and went into the sea. Now, this iceberg, it's really difficult to fathom this, but this iceberg is bigger than the size of London. Yeah, that's huge, absolutely huge. So it has now made its way into the ocean, and it's making its way up towards South Georgia. And the white trails on the diagram are the icebergs, the path that previous icebergs have taken since 1978 up until last year. So it shows you just how far icebergs are traveling now in the sea when they get into it. So really, my message coming home from here is that yep, Antarctica is melting. We are causing change as human beings in Antarctica, but Antarctica does control most of the world's weather patterns. It controls its oceans. It controls how much carbon dioxide we can absorb, how much heat we can absorb. So it's a really helpful part for us. Excuse me. So if Antarctica melts, yeah, we are in trouble. But actually, Mark, the scientist I spoke about, whose photo you've just seen, has real enthusiasm about being able to turn this around. And his mantra is, it's not too late. Everybody can make a change to climate change. So keep that message in mind from Mark, who's one of our leading scientists in the world in Antarctic climate. So I've talked a lot about climate change so far and data on climate change. So I'm going to tell you now about the impact of climate change on human health, because we're all healthcare professionals sitting around this table listening to this. We can all see climate change on the news every day. So these are just some of the things that the climate in the middle. So we have rising temperatures, we have extremes of weather, we have rising sea levels. What does that mean to people? Well, it means air pollution, it means severe weather, it means water and food supplies, it means more waterborne diseases. Yep, well, to the general person on the street, that doesn't really tell us the picture either. So we can then link in the conditions that we have as human beings that come from these climate change impacts. So we will see more asthma, we'll see more heart disease, we'll see more deaths from heat stress. We will see vector-borne diseases moving from countries that they're common in to countries like Europe that they're not as common in because the temperature is rising. We will see forced migration. We will see more war because of the food insecurity that we have, and people being cast out of their homes because they'll be flooded or burned by wildfires. So this is how we can talk about climate change and its impact on health. So if you have a respiratory patient in front of you with asthma, you can talk to them about air pollution and how it's important for them to not only control their asthma, but to do their bit for air pollution, because ultimately they will be helping themselves control their asthma better. So lots of different ways, again, there that we can turn the climate change message into one that fits the particular person that we're trying to talk to. So let's move on to healthcare now and think about what we do in healthcare and how we can help change the climate that we have at the moment. So this is the Hippocratic Oath. In the UK, we have this in medicine, and it says first do no harm. And obviously it was thought up of hundreds of years ago. And yet the first do no harm was about our patients. So yes, we weren't going to give people any healthcare that actually did them more harm. But now I would suggest that actually we need to think first, do no harm to our planet, because you've just seen this previous slide where I've showed you that the things that we're doing to our planet are actually causing ill health in our population. So the healthier we can keep the planet, the healthier we will keep our population. And conversely, the sicker our planet, the sicker our population will be, and the more demand we will get through the doors of our hospitals and our other healthcare facilities. So let's think about that. First, do no harm with the healthcare that we actually choose for our patients. So how is healthcare actually impacting the environment? Well, globally, healthcare is responsible for about 2 gigatons of carbon dioxide emissions. And that doesn't tell us a lot either if we don't know what a gigaton of carbon dioxide is. Well, it's just under 5% of the global net emissions. So 5 out of every 100 tons of carbon dioxide in the atmosphere comes from us as healthcare professionals doing things to patients to make them better. So in doing things to patients to make them better, we're making our planet sicker. And if we bunged all the healthcare across the world into one country, we would be the 5th largest emitter in the world. Or another way of thinking about it is coal-fired power stations. Now we're all trying to move away from fossil fuels, but healthcare is the same as burning 514 coal-fired power stations 24 hours a day, every day of the year. And where does this carbon emission come from in healthcare? Well, about 50% comes from the stuff that we use, the medicines, the devices, the medical devices, and the other goods like PPE that we use in our everyday practice. And about 25% in the NHS in the UK comes from our medicines use. This pie chart has been developed by NHS England, and in Scotland we are also working to a climate emergency and sustainability strategy. And you can see in the blue there, the right-hand side at the top, 20% is coming from our medicines and chemicals as Scope 3 emissions. And on the left-hand side in the green, you can see our anaesthetic gases and our inhalers for asthma and COPD are contributing to carbon as well. So putting those two together, it's about 25% carbon emissions. But as I said right at the beginning of my talk, it's not just about carbon, but it's not just about the carbon footprint. It's about where that carbon footprint comes from. So this is a depiction of where the carbon emissions are highest across healthcare. And you can see the really high orange one. The orange is primary care, and the really high one there is pharmaceuticals. So that's including our GP prescriptions, our general practitioner prescriptions in the UK. And if we look at the green bars, that's our hospitals, our acute service. And again, you can see the highest bar there in the green is our medical instruments and equipment, because so much of our equipment now is single use. Even if it's metal, it's still single use. In the NHS in the UK, we use hundreds of millions of pairs of scissors every year in our theatres just because they're single use and we have to dispose of them after one snip of the scissor. So it's really interesting to look at where the emissions are coming from. But yet, not just about carbon, it's also about that pollution aspect. And not many people know that when we give patients drugs, that drug also has the same effect when we pee and poo it into our toilets and it goes straight into our environment. It has those effects in the environment as well. So we are polluting the environment and we are causing harm to the life that lives there. And there are 2 really interesting websites there on the QR codes that you can access later. One is the partnership that I founded. We've been working for 7 years on pharmaceutical pollution, so lots of resources there. And the bottom one is a report from OECD on pharmaceuticals in the environment. It's a really, really interesting and eye-opening read. So how is medicine polluting the world's rivers? This is the biggest study that's ever been done in the world, just published a couple of years ago. Every continent of the world, including Antarctica, it looked at 258 rivers. It looked for 61 pharmaceuticals, and in over a quarter of those rivers, the concentrations of the drugs that were found were actually a threat to either environmental and or human health. So that's really quite staggering. really common medicines that we're finding: painkillers, antibiotics, anticonvulsants. So we know that healthcare is causing more carbon emissions. We know that it's also a polluter with not only the pharmaceuticals, but the disinfectants and all the other chemicals that we use in healthcare. Our wastewater treatment plants across the world were never designed to remove these chemical substances. So they end up coming out of the treatment plants. Maybe some being removed, maybe not. It depends on the drug, it depends on the chemical, it depends on the rainfall. So they end up in our environment. So now we have to think, okay, what is sustainable healthcare? It's high quality, it's evidence-based, it delivers value to the patient with outcomes that really matter to people, and it provides positive social impact, and it affects the environment as little as possible, both now and in the future. So there's some really important words there that I want you to remember. So it's evidence-based, it delivers value to the patient, and it delivers outcomes that really matter to the patient, and it affects the environment as little as possible. But actually, when we talk about value, this report from OECD tells us that 20% of the care that we provide offers zero value. So why on earth are we offering it? And 1 in 10 of our patients is unnecessarily harmed at the point of care. So the patients come to us sick and we make them even sicker. And we're using 10% of the money that we're spending for our hospitals in fixing those mistakes in our patients. We know there's far too much overdiagnosis and testing, and as a result, too much overtreatment as well. So for me, this is a really staggering slide. So if we're being evidence-based, why are we offering care that has no value? So that's something for you to think of in your role as a healthcare professional. We need to have more of the conversations about the benefits, the risks, the alternatives, and actually, do we really need to do anything? What if we do nothing? So I think this is a really useful acronym, BRAN. Too often we send patients away with a prescription for a medicine. They go to their pharmacy, they get their medicine, they take it home, they open that box, and what do? They pull out the patient information leaflet, which is normally about 2 foot long, in the tiniest of writing. And it's got tens and tens, if not hundreds, of side effects, and they go, oh, gee, I'm not taking that tablet. But actually, so that's a waste. That's a waste of money. It's a waste of carbon emissions to make that product. It's a waste of pollution because sometimes they flush it down their toilet to get rid of it. But if we have the conversation earlier in the consultation, this is a medicine I could give you, but it's got these risks, and it'll probably only work in 1 in 6 people or 1 in 5 people maybe. But you could do this. You could go for a walk. You could do cognitive behavioral therapy, for instance. But actually, I don't think that what you're presenting with is too risky right now. Let's wait and see how it goes in another month and come back to me. And if we start to have some of those conversations with patients, we will start to use fewer medicines. We will start to do less harm to our patients with the side effects. Because we know that even if they get past the patient information leaflet, 50% of our patients don't take their medicines anyway, or don't take them as they should. So that leads to a decrease in clinical outcomes. And remember, my sustainability slide said we have to have clinical outcomes. So we don't get the clinical outcomes. They still feel sick. So they go back to the doctor, go back to hospital, they call an ambulance. So we are actually putting the patient on a merry-go-round. They're going round and round the healthcare system because we haven't talked to them. We haven't had shared decision-making with them about what the best treatment is, if anything at all. And this shows you that, you know, as you go round that merry-go-round, yeah, we are having more CO2 emissions. We are giving them more medicines. We are admitting them to hospital. We're doing more things to them. We're using more stuff. So let's get them off that merry-go-round and have sensible conversations with them. This is the waste. I used to work as a community pharmacist many years ago, and this is the waste that I saw from one patient who had died. So yeah, patients aren't taking their medicines, and as healthcare professionals, every intervention is an opportunity to ask people, whether you're a pharmacist, a doctor, a nurse, a physiotherapist, a biomedical scientist. We can all have a conversation with people about their healthcare, about their medicines, and even if we can't help them, we can refer them to someone who can help them. So tell them to go and speak to their pharmacist or their prescriber. And those medicines that we're using, they are causing adverse drug events as well, and they are putting more and more people into hospital. And we can see there that 20%, 1 in 5 patients who are admitted to acute medical units are there because of a medicine that we gave them to help them. So it just brings into focus the need to have those conversations with people. This is just a bit of a funny slide for you, but we have a doctor in America who says that if a bad thing is happening to a patient, just think that a drug did it until you prove that otherwise. So it really does, again, bring into sharp focus. We need prevention. We need to be working with people around social prescribing, about getting them fitter and healthier with exercise, with a healthy diet, so that they don't need the healthcare. So if we can prevent ill health, we prevent the ill health of our planet as well. In Great Britain, we have the Royal Pharmaceutical Society, and I helped them to develop sustainability policies around these 4 main headings. So they're freely available on the internet to anyone. So if you want to get some top tips on how to tackle any of these 4 areas, do have a look at those sustainability policies. They're really, really useful. I want to come to the close of my presentation by kind of pulling together everything that I've said today. So I've talked about climate change data and how complex and confusing it can be, and we've got to get the right data for the right audience. I've then talked about what climate change is doing to human health, and then I've talked about what human health is doing to the climate, to the environment, to the planet. And actually, we need to start thinking as healthcare professionals with a One Health lens. And this One Health triad is actually saying to us that the health of people, of the environment, and of animals are all intrinsically linked. And that if we have poor health in one of those sectors, we will have poor health in the other. So if I talk to you about the pandemic, we had a sick bat that got a zoonotic virus, transferred it to healthy people, killed millions of people, but we also damaged our environment with the huge amount of PPE, of single-use plastic that came into use. So we could see there that sick animals led to sick people, led to a sick environment. So you can really begin to understand why it's so important to keep our people, keep our population healthy, keep our patients healthy, so that means that we have a healthier environment, that the healthcare we're using, we're providing, isn't making our planet sicker. And all the things around the outside of this diagram are all the things that our planet does for us on a daily basis without asking for help. So if our planet is sick, these things begin to stop. So just to finish off, my take-home messages. Yeah, we've seen that climate data, really confusing. It can lead us to eco-anxiety. It can lead us to catastrophize, to take inaction, just to freeze. So it's really important that we use robust evidence, but we don't necessarily have to deliver that message as teachers, as students, as healthcare professionals. We don't have to use the same evidence to deliver the message. We need to make the data that we have relevant to the audience that we have. So it's really easy to scare people. I hope I haven't scared you today. I've told you about the problem, but I've given you lots of solutions at the end that we can take away in our practice as healthcare professionals, but also just as our practice as a human being. So tell people what the problem is, but also give them something that they can do. Because climate change is absolutely an opportunity for everybody to do something a little bit different, something that helps their health and helps our planetary health. And as you've seen in my slides, every little bit of help that we can give our planet really is good in terms of halting temperature rises. So my main message back to you is everybody can do something, every little bit of action helps, and you can make a difference. And so can every patient that you speak to. And the choices, this is one lovely morning I got up in Antarctica and was met by a very, very calm sea within a bay. And it just got me thinking about this quote that I'd read at IPCC, that the choices we make today will determine the changes in climate that we experience in the future. So it's about us as human beings making choices, making the right decision so that we experience the climate that we want to in the future for us and for our children moving forward. So yeah, climate change absolutely is a health crisis, but I hope I have shown you an inkling of opportunity here that health can actually change the climate crisis that we're in. So thank you for listening. I'd be delighted to take any questions now, and if there's not enough time for all the questions, I'd also be delighted if you contact me through my email, through my LinkedIn or Twitter, or you can also contact me through the website there. So thank you so much. I hope you enjoyed that, and I hope you learnt how to use climate data a bit better.
Wonderful. Thank you so much, Sharon. I'm sure everyone online is very grateful for Professor Pfleger's presentation then. I think I am a little bit scared. It's sobering, but I definitely have taken away from that we can make choices that benefit our students, our colleagues, the people online, our patients, but also us. And I really enjoyed listening about your Antarctica travels. And I'd never thought about pharmaceutical pollution in water before. So that is absolutely new, and I've learned something great tonight. We do have a question in the chat, so I'm going to ask you for that in just a moment. But one thing that I would love your thoughts on, and you shared some of the slides and the graphics with us in this session. There are, in fact, lots of really amazing infographics in this space. I'm really impressed at how well presented a lot of the data is. It's very engaging, but there's very fast. So being able to manage such fast moving data and keep abreast of it, I would love to know your hints and tips on that one.
Yeah, gee, that's a really difficult question, actually. You know, as healthcare professionals, I think I've seen some research that doctors would need to read something like 400 new papers every week to keep on top of the evidence base for the conditions that they're treating patients for. And it's a bit like that in climate change. I watched one of your other talks in this series from last year, actually. And for the IPCC report that I'm talking about, they used 7,000 pages of evidence. So I don't know if any of us is actually able to keep on top of all the evidence. I certainly find it difficult, and I'm working in this space. What I would say is to use well-renowned sources for your evidence. So some of the slides I showed were from NASA. There were some slides that I often show from Copernicus. Copernicus is a climate change service across the world, and just today they are releasing that we had the hottest April ever, and that's following the hottest January, February and March ever. So Copernicus is really helpful as well. The IPCC reports, quite often you will get organisations like the World Wildlife Fund that actually translate what IPCC say into evidence. And I guess just keep connected. I find lots of new evidence on things like Twitter, X and LinkedIn. I join chat groups, or I join subgroups of these platforms that are into environment and sustainability and healthcare. And quite often you get so much coming to you that you really have to sieve through it and see what it is that you actually need. So I'm sorry, I don't have an easy answer to that. It's just, yeah, keep connected. Know your robust data sources and know who looks to those data sources and translates them into easier stuff for people.
Excellent. Thank you so much. So I'm going to jump to the question we've got from Craig Webster. Craig's from New Zealand. Thanks for a great talk, Sharon. He says, are tech development and enviro damage inherently linked? what do you think the environmental impact? What do you think of the environmental impact of AI, for example?
Wow, yeah, there's another great
Do
question.
we
So
want another
I think
half an hour?
I think that tech development can be inherently bad for the environment. But I also think that tech development can be good for the environment because it can give us new ways of doing things that are more efficient. For instance, if I think about theatres and doing endoscopies on patients, in the UK, we use single-use endoscopy equipment. When I was speaking to a gastroenterologist last week, and that just flummoxed me, quite frankly. The equipment is so expensive. We use it on one patient, one time, and we throw it in the bin. So I think that if we can develop tech that we can reuse, and we can develop a sterilization process, for instance, that is good in terms of its energy use and its carbon emissions, that would go a long way to helping our theatre carbon emissions, for instance. AI, I don't know a lot about AI, but I do know, I think that we our data services that we use for that use a lot of energy, our data centers. So I probably, Craig, can't give you a great answer on that. But again, I think AI, in terms of how we treat patients and how we triage our patients, could actually be very useful for us because it could save lots of miles, patient miles, to GP services. During the pandemic, we saw that our Zoom services for patients, our Teams appointments, in Scotland, we saved over 1 million patient miles of travel just during the pandemic, and we're still using Teams messages for some appointments. So I think, yeah, development can be bad, but it also can be very good, and it can change the way that we do things and make us much more efficient and make patient pathways much more desirable for our patients.
Thank you, Sharon. Thank you, Craig. I had a question also about how our evidence base is developing in terms of managing that infection risk so we can move away from single use. I noticed that Amy Chan has put a question up there as well. So it might be our last question, then we need to let Sharon go.
Right.
Amy has asked, do you think governments around the world are taking sufficient action to minimise the effects of climate change on health? What more could our governments be doing?
Okay. So I think I can see in the data that I'm seeing every month, especially the Copernicus data that's telling us that the world is consistently hotter, that governments aren't doing enough. I think we've seen from the media coverage of recent COPs that governments aren't doing enough, that we can do more. And it's a bit like the pandemic as well. It doesn't matter if one government's doing great things. It needs every government around the world to be doing great things because one country can't solve this issue. It's a worldwide, it is a pandemic. It's a worldwide issue. What more could our governments be doing? I think one of the really huge things that they could be doing is infrastructure, is travel infrastructure. In the UK, we do not, I would say, have a great travel infrastructure. It's very expensive to travel by train. People end up traveling from Scotland to London by plane because it's much cheaper and it's much faster. So we need to do something to help our public. Our public can't do this alone. Governments can't do it alone. So I think travel infrastructure is a big thing. And I also think that we need to make it easy for people to make the right choice. One of my last slides was about making the right choice. So if we're going to ask people to walk more, to cycle more, again, we need safe ways for them to do that. And in my country, people are quite scared to go on the roads with their bikes. Firstly, because the roads are in such bad condition with potholes and you end up falling off your bike. And secondly, because we haven't got designated cycle lanes across much of the UK. So it's quite dangerous to cycle in heavy traffic. So governments have to help the population to make the right choices. So in terms of keeping us healthy and keeping us out of our healthcare, that's another thing they could be doing.
I would have to agree. And another reason why it was a bit sobering tonight, Sharon, is that Australia busted the planet on the 5th of April, is what I've learnt. So we are definitely, we need to pull up our socks. Thank you, Amy and Craig, for your questions. Professor Sharon Pfleger, thank you so very much for your time this morning, this afternoon, this evening, and thank you everyone who has participated online. We are so grateful for your insights tonight.
It's been an absolute pleasure. Thank you so much for having me.
Thank you. Thank you, everybody. Please reach out to Sharon if you have questions via her email.